Moving forward, our approach towards UHC is centered on 3 critical drivers, which focus on 1, expanding health insurance coverage. We want to increase the insurance coverage from the current 36% of our population to 100% by 2022. This will be through the National Health Insurance Fund, and private health insurance will provide supplementary insurance to the population. The second critical driver is access to services. When people will have health insurance cards, they will then need places to access health services from. We intend to increase access through strengthening primary health care, from the community to level 4 services, and in addition, optimize higher level tertiary care in the level 5 and 6 hospitals. In order to ensure that the population accesses services, we will need to optimize the human resources for health in terms of numbers, the skill mix, and capacity building. Commodity supply, whether in terms of medicines, laboratory commodities, radiology, diagnostic services, will also be key in ensuring that access to care is ensured. And I'm happy that KEMSA is actually represented here to answer any concerns around the area of commodity supply. Coupled with the shortages of human resource across the world for health, digitization of health services will become key in terms of ensuring that services reach the people. We in some places do not have enough medical specialists and other health workers in order to be able to ensure that services reach people across the country. One of the things that is being done now is a project called Healthcare Information Technology System, which by the end of this year will have all the 98 hospitals that are under the medical equipment leasing program interconnected and having one data center in Nairobi based at the Kenyatta National Hospital. The first project to bring services, specialized services closer to the people will be in the medical, diagnostics, radiological diagnosis, where 13 specialist radiologists will provide 24-hour cover for all the hospitals in the country. Therefore, a patient in any part of the country will get access to a radiologist where their radiology exams will be reported from Nairobi, but they get their reports from the place where they have received their services. As national government, we intend to revamp the regional cold chain depots for drugs and vaccines, as we have just said that vaccination has gone down in the last 1 or so years. The cold chain revamping will ensure availability of safe and high quality drugs and vaccines across the country. As we speak, about 2,700 cold chain equipment have arrived in the country, ready for distribution across 3,000 facilities in the country. We also intend to establish 4 specialized cancer hospitals across the country to reduce the financial burden faced by patients seeking cancer care. 37 computerized tomography scans will also be installed in the next 1 year, and 1 center of excellence for kidney health will also be established at the Kenyatta National Hospital. Due to demand, 21 additional hospitals will be included in the medical equipment leasing program from this year, taking the total number to about 110 across the country. The third critical driver is developing sustainable financing models for healthcare. With this, the health financing strategy for universal health coverage will be finalized and implemented. Government will increase its budget towards health, as you have seen from this year's budget. We hope this will keep increasing over the next 4 years to ensure that all Kenyans are financially protected from potential catastrophic expenditures towards their health. Private sector investment will also be part of developing, sustainable financing for health, including local manufacturing and such other initiatives. Public-private partnerships will be enhanced in order to ensure that the whole population receives care. To further strengthen and scale up reforms needed and ensure achievement of UHC by 2022, as well as to innovate strategic interventions, the Ministry of Health has set up key coordination structures for the purpose of ensuring harmonization and alignment of health sector stakeholders' investment towards universal health coverage. This includes a National Universal Health Coverage Oversight Committee, chaired by the Cabinet Secretary for Health and co-chaired by the Chair of the Health Committee in the Council of Governors. It has representation from the Presidency, the National Treasury, and key stakeholders like the World Health Organization. We also have a National Interagency Steering Committee where we have representatives from all stakeholders in the health sector in the country. Public, private, NGOs, CSOs, and other organizations that work within the health sector in the country. Below this, then we have the technical working groups in the areas of health financing, legal changes that may need to be undertaken, communications, human resource. It is envisaged that similar mechanisms will also be replicated at the county level, and that these structures will provide a platform that will ensure development and implementation of strategies that will steer our country towards affordable health coverage while ensuring efficient allocation and utilization of resources. In terms of population coverage, we look to partner with the county governments to further support UHC implementation through advocacy and retention and enrollment into NHIF. We will map out areas that have not been reached by essential services in order to ensure that no part of the population is left behind. Services will be targeted to areas that have not been reached by essential services. Vulnerable populations will be identified and financial protection provided for them through subsidies. Institutional and legal reforms will be achieved in order to ensure that UHC is achieved in any of our organizations that require such changes, including the NHIF, KEMSA. These are already ongoing. In terms of access to care, comprehensive primary health care, including community health services, will become part of the journey towards UHC for the country. Available infrastructure is being mapped in order to optimize its use and operationalize available health infrastructure to achieve full capacity. Human resources, redistribution, employment, and placement to deliver the health benefit package will also be undertaken. Currently, the Cabinet Secretary has gazetted an advisory panel that will come up with the basic essential health package that will be a right to every Kenyan. This is expected to happen over the next 30 to 60 days. Quality care is an essential part of affordable health care, and this will be ensured through participation by all stakeholders.